Our goal is to delve a little bit deeper into the other type of method of collecting data, namely experiments. In the last video, we talked about observational studies, and so we want to start off on the footing of differentiating between experiments and observational studies. You see, if we looked at data as it is being generated, and we decide that we would like to collect that data without any intervention in the data generating process, that will be an instance where an observational study, as we learned previously, will be very effective. A very good example is if we wanted to look at the effect that smoking has on the weights of babies at birth. Well, there is no way we're conducting an experiment in that case, because we cannot intervene and say, let some subset of what? Pregnant mothers smoke, whereas some others do not smoke. That would be unethical. So in that case, all we can do is sit back, let people make their choices, observe, and observe data on the weights of babies who choose, of mothers who choose to smoke and mothers who choose not to smoke, and then compare. On the other hand, an experiment is conducted in order to generate data to see if there is a relationship between the explanatory variable and the response variable. Here's an example of two scenarios where we would like to see which type of study will be very useful. Would it be an observational study or an experiment? Let's say you want to determine the average age of college students across the nation. Well, there is no way we can tweak the average age of, the ages of people in the college. We just observe what is as is. In other words, we're observing data that already exists. And so, in this scenario, an observational study will be very useful. An observational study will be useful. On the other hand, if a dentist wants to look at the effects of a new dental material used for fillings, then in that case, we would need an experiment because the dentist might intervene in the data generating process by assigning the new dental material to a group of patients and administering an old dental material to another group of what? Patients, and compare the performance of the two dental materials. By randomly assigning different treatments to different patients, this dentist seeks to what? To look at a response variable, which is the performance of the different types of material on what? The different patients. So, in general, we talk about the characteristics of an experiment. It is usually a controlled study. It's a controlled study to determine the effects that varying one or more explanatory variables or factors has on a response variable. Here's another example of an experiment. To help assess student learning in a developmental math courses, a mathematics professor at the college implemented pre and post test for our students. A knowledge gain score was obtained by taking the difference of the two scores. What would be the response variable in this experiment, and what would be the treatment? I would argue that the knowledge gain score would be the response variable, because the goal is to compute the difference between the post-test score, the post-class score, and the pre-class score. And the values collected here is meant to respond to the developmental math course, to the knowledge provided in the developmental math course. So this would be the treatment. Students were treated to the experiment, to the condition of the developmental math course. So it is hoped that knowledge gain score will respond to this exposure. All right, that takes us to what constitutes a randomized experiment. Our goal here is to start looking at how experiments can be designed in such a way that drawing causal conclusions would be valid at the end of the day. The first hallmark of a randomized experiment is that researchers assign treatments that they are introducing as intervention to cases in a random way. So, a completely randomized design is one in which the experimental units who will be receiving the treatments receive different treatments but based on a random what? On a random selection process. So, randomized experiments are fundamentally important when trying to show a causal connection between the response and the explanatory variable. Let's consider here a study where a new drug was used to treat heart attack patients. In particular, researchers wanted to know if the drug reduced deaths in patients. So here we have all the patients who are numbered from 1 to 54. Now, we're going to use a principle called blocking. So we're going to create blocks. And why are we creating blocks? And what are blocks going to be about? You see, for some patients, they are at high risk of what? Of developing a heart attack already. And for some patients, they are at low risk of developing what? Of developing a heart attack. Well, what happens here is that in this case, if we were to administer the drug only to at least to low risk patients, the new drug, so to speak, and we administer the old one to high risk patients, these might introduce a systematic bias into the results of this finding. Because one who studies your result here might say, well, these patients were already at low risk of developing the heart disease. So if this new drug was administered to just them, well, they were probably never going to develop heart disease. So using the new drug was probably useless. Well, how do we deal with situations like that? We can create a block, that is the block of low risk patients away from the block of high risk patients. Then what do? We would like to ensure that some people get some group in the new a subset of the low risk patients get the new drug, and some also in the high risk block also get the new drug, and the others will get the old drug, so that those who get the old drug will constitute a group, and those who get the new drug will constitute another group. This will be called the treatment group, who were treated with the new drug, and the old drug will be our control or baseline group, so that we can compare the recovery rates in the treatment group against the recovery rate in the control group. And the results of these findings will be better validated because we are no longer trying to apply the new drug to only those at low risk of developing the disease. So, the process by which we ensure that those who get the new drug is different from those who are getting the old drug must be ensured using randomization. So there must be no bias in selecting those who receive the treatment away from those who are not going to receive it. So at the end of the day, this strategy ensures an equal representation of patients in each treatment group from both the low risk and high risk categories. It also reduces the impact that a confounding variable, and the confounding variable in this case will be the risk level of the patient, might introduce into the results of these findings in a systematic manner. All right. So, with that said, that takes us to what makes a very good experimental design. There are four principles. One, the first step would be to exercise serious control in the way that researchers assign treatments to the different patients or cases. And then they must also do their best to control the differences between the two groups, ensure that the lab rats or the experimental units are as similar as possible, and that the only regard in which they differ is in the treatment that are assigned to the two groups, either the treatment group or the control group. That way, whatever differences we might observe, if there exists one, can be attributed to that difference in treatment across the treatment groups and the control group. Another um, principle of experimental design for ensuring that causal connections can be drawn at the end of the day is randomization. So, in this case, experimenters must or researchers must randomize patients into treatment groups in order to account for variables that cannot be in order to account for variables that cannot be controlled. This will prevent what accidental bias from entering the study. Accidental bias from entering the study. All right. Then third would be replication. So we do not want to apply treatments to only one group. So in a single study, we can replicate by collecting a sufficiently large sample. All right, how are we going to collect large samples? There are sampling techniques, and we're going to discuss that in a little bit. Then additionally, a group of scientists may want to replicate an earlier study to verify if the results are true. Let me put this in this way: to replicate an entire study to verify an earlier finding. Then lastly, you have blocking, which we just saw. So if we notice that a particular variable can introduce systematic bias into the results, so a lot of thought is required here. And under the circumstances, we may first group experimental units, like we did in the last example, here, as we did in this example. We might first group the experimental individuals based on this variable into blocks. So we might do that into blocks and then randomize. And then randomize cases within each block to the treatment groups. This is known as blocking.